To begin with, let's have just a few words about HealthHub Finland, who is the organizer of this webinar. It is one of the European digital innovation hubs in Finland. It works as a one-stop shop for the development of digital solutions for health and well-being, and it's also a great way to Finnish health and well-being data. Many of you might have heard something about HealthHub Finland before, so not many words right now about it, but you can find more information about HealthHub Finland on the webpage at healthhubfinland.eu. And in the background there, you have the QR code or on the slide, which gives you access to the webinar series and also registration link to following sessions. In the series, you'll get to explore the critical role of data and technology in developing innovative health and well-being products and services. These webinars will offer you hands-on tutorials, expert insights, and actionable guidance in areas like app development, chatbots, cybersecurity, EHR integration, and regulatory compliances. And also, these will provide you possibilities to gain practical tools and skills to enhance your development activities. And as mentioned, some housekeeping. Let's keep the microphones off during the presentation. Chat is used during the whole time, so you can keep your possible comments or questions there, and we'll get back to them after the presentation. And then in the end, we'll also have possibility to discuss, and you can open your microphones and ask questions and any comments if you have. So in today's session, we'll dive into the process of designing digital health solutions from idea to product. And we have Dr. Guido Giunti, a medical doctor specialized in digital health design and development, who will guide you into this team, sharing his experience with the challenges and the opportunities and the key lessons learned when turning an idea into real digital health product. So, Guido, you're welcome. The screen is yours.
Thank you so much, Veera. Thank you, everyone. I'm happy to be here. I'm going to start by doing the age-old time question of, can you see my screen?
Yes, we can.
Perfect. Excellent. All right. So let's dive in and start talking a bit more about the whole thing of designing digital health solutions. And I think that the best way to start this is by asking a very simple question, which is basically, what exactly do we mean or do we understand by when we say about digital health? And this always presents us with this question of like, okay, are we talking about something that is more like healthcare, or is it more like a tech thing? And it's a challenging situation because usually, for example, when you are trying to understand what does it mean to innovate or to create, we tend to have this notion, this idea of this out of the box thinking, this concept of like, well, we're going to be common and disrupting things. And the ethos of innovators or startups usually is this idea of moving fast and breaking things. But when you're thinking about in terms of healthcare, the things that we are breaking are patients. We're talking about people. So just from an overall perspective, the idea of moving fast and breaking things feels a bit unnatural. It feels a bit like we're talking about like apples and oranges here. So the idea of this conversation that we're having today has to do a bit more with how can we actually see about combining these apples and oranges in a different way. So let's start by taking a look at what would be your average digital health journey, or what usually happens when someone is thinking about creating a new digital health solution. So usually we start that there's a patient population, there's something that is happening, there's a specific need, there's a specific issue that patients have, and usually an innovator looks at that and comes up with an idea and automatically starts thinking about a product, and we think that we're going to give that to the patients. We think that there's going to be a very smooth transition that's going to go all the way through from our idea, usually involving a developer team here. But more or less, that's kind of what we're thinking here. So, but usually there's a lot of issues that happen here. We haven't even started thinking about, okay, is this idea useful for patients? Is it really a need that they have? What exactly is the issue? But let's assume that that part of the journey went well and you actually identified a need for a patient population. What's the next step? Well, usually the patient will bring this up to the healthcare professional, say, hey, I found this app, I found this device, I found this service, can I use it? And here's where the first hurdle comes, or the second hurdle actually comes, which is like, well, as a healthcare professional, what do they feel about this? Is this something that they can integrate into the workflow? Is this something that they can see value in this? But okay, fine. Let's imagine that it has value for the patients, it has value for the healthcare professionals. What's the next step? Well, healthcare professionals usually work in a context. We're thinking that if I am a healthcare professional, I work in a clinic, I work in a hospital, I work in a community center. So how does this adoption, this new technology that you're bringing to us, how does this make sense in this concept? And this is where we start thinking about, okay, well, what is exactly the evidence that you have here? Is this something that I can use? And then you start figuring out, okay, do we need to come up with some kind of a randomized control trial? What are we really doing here? And all of this time, we haven't even thought about, okay, what are the current policies that are in place here? We don't understand what are the commercializations, who is paying for all of these things. And all in all, we're thinking only about the patient. We're not really thinking about all of the things that are happening around that patient. So for example, if I'm trying to lose weight, it's very difficult for me to do that if everyone at home is eating McDonald's. So these are all of the different challenges and obstacles that we see here. We're talking about an unclear value proposition. There's challenges in the adoption. The business models may not be sustainable. The healthcare system is usually something that is not easily integrated with, and there's not a robust evidence that is supporting us. So it's about trying to figure out how we grab these oranges and apples and we put them together in some kind of a way. So, for example, in order for our out-of-the-box innovation to actually work, we need to understand what exactly is the box that we're working with. So in that sense, we need to understand what are the foundations of the system, of the healthcare system, and of our target country. So for example, if you're working here in Finland, one of the challenges is to actually understand that this is a highly digitized country, that this may not be an experience that is actually translatable to other situations, because for example, we're talking about here that there's over 20 years of countrywide EHR. We're talking about e-prescriptions being available for a very long time, and that affects not only the infrastructure that is present, but also our expectations as patients and consumers. It would be very unusual for me as a healthcare professional or even as a patient if a solution is not integrated into the standardized care pathways that we have. So we need to understand in the concept, in the context of what we're doing, what is the infrastructure, what is the healthcare information system that is actually present in the space that we're going to be working with the innovation? Are there any specific resources that we can take advantage from the currently established places, but also what can we actually do? We also need to have a proper understanding of what are the actors that are in place. In different countries, there are third sector agencies or like patient associations, foundations that have a major role in the development of the healthcare situation. And we also need to understand, okay, are there large authorities? Are there, I don't know, universities, researchers? What is the investor scene? And how can we understand that for our specific solution for that specific country? We need to really thoroughly map our landscape so that we can actually deploy properly. And if we're thinking about commercialization, for example, here in the screen, we have a patchwork of evolving frameworks. This picture right here is just trying to represent about digital therapeutics, and this is less than than 2 years old, and half of the reimbursement models that you can see here have actually changed or adapted into some other way. So this is a rapidly evolving field, and we need to figure out what exactly is the way that we can link our innovation to an actual reimbursement pathway. Otherwise, this is not going to be sustainable. And at the same time, we keep thinking and we keep hearing about all of these innovations and how generative AI can actually be applied for these solutions. But there are actually regulations that are determining very much what we can do and restricting what we can do with this innovation. So we need to figure out how can we align all of these different actors and how we can align our process of development. So in a way, we're thinking that, okay, we can have this out of the box thinking, then, but we also need to figure out how do we put this idea back into the box because everyone else is working within this box. And one way of understanding this is that basically, the further along that we're going towards having a much more strategic deployment of the technology, a lot more burden is required, not only in terms of regulations, but also in terms of evidence. It's not going to be the same if I just have like an educational solution that is going to be providing you with videos for patients, than if we actually expect that this is going to be integrated as a digital therapy. So you'll see that in reality, a digital health is kind of like a very techy healthcare. We have a bit of all of these downsides and upsides of both places all together and combined. So we're talking that there's this kind of like a Frankenstein between an orange and an apple that starts to take shape here. So one of the things that I think is useful is that we actually take a look at what are the different processes in terms of the design, development, and testing of these digital health solutions, and see if there's a way in which we can find potential synergies. So, for example, you can see now here in the screen different cycles that we have. So, for example, you have the scientific method, you have the software development processes, and the business development, and you can see that there are presented here as a cycle, and there are different ways in which we can combine them, but let's see about exploring each of these one by one, just to see how these apply for digital health. See if there's a pattern, a hidden message that we can find within all of these solutions. So just let's start with the scientific process very easily. Let's now unfurl this cycle, and let's start exploring them one at a time. So, for example, if we're going to be looking at this as scientists, if we're applying the scientific method here, usually you start with, there's a phenomena, there's something that we're observing in a population. In this case, let's say, for example, type 2 diabetes. So one thing that you can ask is something that emerges from the research method, the scientific method, is asking this question of, well, what is relevant for this population? Then you take a look at the context, usually by taking a look at the literature. You come up with an hypothesis. There's, for example, symptom management is something that can be useful for this. And then you come up with a prediction. Like, for example, if we monitor blood sugar and the symptoms, it will help prevent the complications. Now, you will see here that the next step from the scientific process would be data collection. But there seems to be a suspicious empty space here. So there must be something that I'm going to reveal now. And the reality is that we actually need to look at the funding. We need to look at how is this research actually sustained. We need to think about that because in general, in sciences, we tend to only focus on that aspect, and we think of this as isolated from the process, but it's a major issue because if we are not able to secure funding for our research, it's going to be very unlikely that the research actually progresses. So it's a step that we tend to think about as not part of the process, but it's kind of like a tacit situation there. But all right, let's imagine that we get the funding. We are managed to fund our research and we start data collection. For example, we draw the blood samples, we follow up, and then we come up with a manuscript and we analyze all of these things. And the idea is that, of course, as this is an iterative process, if we want to look into this of, okay, how can technology work on this? You again do the literature review, you come up with an idea or hypothesis. You come up, for example, with the concept that, well, maybe a feature for symptom tracking could help with that. You get funding, and then you do data collection, and then you decide the study, and you try to figure out, okay, maybe using this app helps us with the symptom management. And that in itself would be the scientific process applied for this specific situation. If we're looking at it from a software development, well, usually a simple way of thinking of this is like, let's say that you want to make a game. You have the idea of, I want to make a tic-tac-toe game. We again have the ominous empty space here because, of course, you need to actually either figure out how to get the funding to develop the software or figure out a way of funding your own time while you're developing your solution. So this is also a hidden part of the software development process that we need to consider. But okay, let's imagine that you want to make this game. So then you need to create, like, gather all of the requirements, and you need to understand, okay, let's come up with a technical document. We need to define them. Like, for example, we need to figure out for tic-tac-toe, what are the rules? What does it look like? We need to hire our development team. We need to test it, make sure that all of the different things play. What happens if I touch the buttons? Does it behave like I do? I expect it to do. And then we need to deploy it. And if we want to add another feature, we go through the same process in an iterative manner and add more features and more processes. Now, let's take a look at the business development side of these digital health solutions and see what actually happens here. So usually you're thinking here, okay, we need to identify a need. Let's see. Probably symptom tracking is something that people with type 2 diabetes could use, but we need to actually validate this. Basically, how do we know that they really need that? Is there anyone willing to pay for that problem to go away? And then we need to come up with an idea, in this case, the product. We need to validate that idea. We need to understand, okay, are there other people working in the space? Do people like our idea? Do we find any way that this can be done? We need to come up with a business model for this. For example, what is our differentiating factor? What are the costs? Is there anyone we should partner with? How do we pay for it? How do people pay for the service? And then go on and create a business planning. And basically figure out how do we generate revenue? Do we cover enough of our infrastructure with the revenue, and so on and so forth? And the key thing is, as you can see, there's no missing gap, because the whole point about business development is trying to get the funding, trying to get revenue. So if we start to think about how can we align all of these different cycles, it's easy to understand them that, for example, let's imagine that you're trying to come up with a digital health solution, and you think that this app can help this patient population. Okay, so then you can go through all of the development process and then entering the testing as part of your data collection process. Or, for example, let's imagine that you're doing qualitative research, you're trying to do interviews with patients, and you use that interview process as a way of gathering the requirements for your software development. Or, for example, you can fund the research through doing as part of one of the channels of your business model for your startup. And there are different ways in which these different aspects can connect to the different ways. And the idea is that we need to figure out a way in which all of these different channels can coexist in a way that they're aligned, because we're talking, as I said, of something that is a very techy healthcare, so we're bound by the constraints and the limitations of both healthcare and tech. So there are these ways in which we can find common ground. Now, I would like to tell you a bit about a specific case in which we actually were trying to navigate these challenges of doing all three channels at the same time, with one specific case that I think is useful to understand the process. And this is the case of a More Stamina solution, which is a project and product funded by Business Finland. Very broadly speaking, the idea is that More Stamina is a digital health tool for people with MS, multiple sclerosis. The idea is that we design this tool so that it uses behavioral change techniques so that people get personalized recommendations about the day-to-day. We aggregate all of that data to understand things about the condition and monitor the patient quality of life. And every single step of this was done using an evidence-driven method that combines all of these ways that I was saying. So in order for you to get a proper sense, let's look into that journey a bit deeper. So MS, just to give you a perspective, it's a neurological degenerative disease. It affects a relatively low number of people. We're talking that in the world, we're talking about close to 2.5 million people. However, this disease has a lot of burden into the life of patients with the condition. So we wanted to start understanding what can we do for them, and how can we start this in a very patient-centered way. So, for example, in the aspect that we approach this for the patient, we started thinking like, okay, from an understanding of the patient needs, this is not a patient in isolation. We need to understand the broader picture of people with MS. So we try to understand and include not only the healthcare professionals, but also how we can do this in a research manner, and incorporating people with MS and the family of these persons. So, for example, one way that we approached this was by trying to do a very simple qualitative studies, doing focus groups and interviews, where we basically ask people with MS, what are your problems? And then we ask healthcare professionals, what do you think the problems of people with MS are? And one thing that happened here is that we very clearly identified that people with MS had this specific need of fatigue management, and that they both believed, both patients and healthcare professionals believed, that maybe technology could be the solution here. So instead of running away and start to think about how do we create a product, what we did was try to understand, well, maybe there is already products out there. Can we somehow do an overview? We can understand the landscape. And we reviewed thousands of applications, and we only found that there were, at that time, about 25 different solutions, and none of them were actually for people with MS addressing the fatigue management need. So at that point, we figured out, okay, let's now come up with an idea for a concept, for a feature, for a solution. And the way that we did that was by doing a code creation workshops where we had software designers, software engineers, designers, nurses, physios, clinicians, patients themselves, all through this series of workshops in different parts of the world. We tried to understand what would a fatigue management solution look like for these people. And only then did we involve the design team and the developer team to actually carry out the thing that has been designed and developed in combination, in co-creation sessions. Now, we combine these different types of features and try to understand how can we align this with established behavioral change models, and we iterated over and over so that we come up with this specific solution. So in this way, we came up with a specific digital health solution that we were able to deploy. And then we started figuring out, okay, let's now try to look at this in the real world. And the way that we've done this is by creating multi-center mixed method studies. And we did the first one here in Finland last year. It finished, and this has just been published. And people with MS use the app for 2 months in their day-to-day life. And they found it incredibly useful, and this was something that validated that this was not only a feasible solution, but they wanted to use it, and that they actually used it in the day-to-day. What's really interesting about this is that we actually involved, and a lot more information about new features emerged from actual real patients using the application in the real world case. But the way that we kept these things is that by actually having a very active patient and public involvement. Like, for example, in the project, we have people with MS as strategic members of our panel, and we have them as actual people who were part of the team, paid members of the team, who were actually part of the design process. And all of this has worked in a way in which we have gone over and over to create more evidence and try to strengthen our value proposition and our business proposition. So, for example, when we're looking at the healthcare professionals, we went to different parts of the world. In Europe, we went to Switzerland, to Spain, and here in Finland. We provided the application to healthcare professionals. We tried to understand that, and that in itself proved that a lot of these people, healthcare professionals, found this solution to be incredibly useful, and they strongly agreed that they wanted to have this more integrated into the workforce. But further, one of the things that we need to understand is that we need to do this in a health technology evaluation. So we've been actually involving the different ways of doing health technology evaluations as a way of guiding our product development. So basically, we know that there are certain things, certain regulations that we're going to have to face once you reach market. So the more you build your portfolio of evidence, your portfolio of requirements throughout and towards that idea, the easier it's going to be. And you need to be keeping going in this very, very much active participatory approach where you keep involving healthcare professionals, you keep involving people with MS and their families to be part of this. So, for example, one thing that emerged from this is that in our solution, we ended up having to develop not only a solution for the healthcare professionals and for the patients, but also for the family members. And these are all features that emerge from the work that we're doing and from approaching these things in this way. Now, there are certain things that we're incredibly happy about this is that, for example, we can provide you with an evidence trail of every single step of the process from the design, development, testing. There's an actual scientific paper that supports and guides the next step. But this type of approach has been incredibly useful because, for example, it has gathered a lot of different attention because a lot of these different solutions that are currently available, they are not following any kind of a process like this. They're following a much more traditional approach, and we've gotten a lot of attention, as I was saying. But the important thing is not only the attention that we've been getting from the media for this particular approach, but also the fact that patients themselves from all over the world are approaching us and asking us questions because they want to be part of this. So one of the things that I want us to keep back, and that's why I think it's so important, is that we need to understand that we're having this out-of-the-box ideas, we're having this out-of-the-box thinking, but we need to understand the box, we need to understand how to talk with the box, and we need to understand how to actually work within the limitations that the box presents us, because the way that we're approaching healthcare, it's in a different approach. We need to understand that we're all going to have to be playing a different part so that we can actually enhance and improve the capacities of our healthcare system. Because it's not only about trying to understand what's the best technology, it's about trying to do something that is right for the patients, something that is right for the healthcare professionals, and something that is a lot more useful and much more sustainable in the long term, not only from a business perspective, but from a healthcare perspective. And hopefully, at the end of this process, if we manage to understand a bit well the differences between apples and oranges, we can come up with some kind of a happier distribution of the information and of the solutions so that we can actually create products that are meaningful for everyone. So thank you so much for your attention, and I hope that this was useful for you.
Amazing. Thank you, Guido. I think this provided a great overview for the environment and the kind of processes that digital health development happens in. Now we have time for questions. Do we have any? The chat was really quiet, so people were really engaged in listening to you. But do we have any questions or comments for Guido now from the audience? If not, no worries, because I do have like some questions and ideas to discuss a little bit further. First, I would like to dig into the using Digi. Okay, now we have, maybe we take Kaisa first. Kaisa, please, welcome.
Well, thank you, and very much for the wonderful presentation. The question that I would have is that, Guido, you and your team, you've been doing a lot of the, reporting and documentation and all of that, and maybe based on your background and the university involvement, that's how, it has been the way to go forward. But like you said, most of the companies don't do that, startups with their ideas. So how would you, balance this, that, that there needs to be some reporting and validation and some, documentation, but that, maybe not everybody can write, as many papers as you've done. So how would you address that issue?
No, absolutely. And that's a great question, Kaisa. I think that, of course, we need to understand that what I just presented now about More Stamina's journey is a very specific case. I don't imagine that this is something that needs to be the journey for every single solution. But what we do need to understand, one of the things that we're working at the moment with the results of our project at the moment has to do with, okay, what are the steps so that we can create a model that would be, let's call it the minimum viable process and evidence that you need so that you actually meet your not only the medical regulation aspect, but also your evidence requirement. Because, for example, because we were trying to come up with this evidence-driven approach, that's why we were following this specific way. I really doubt that a startup would actually be able to replicate this simply because, well, this is 5 years worth of efforts and different funding instruments and so on. If you wanted to do this, we need to come up with what is the minimum thing that you can reduce to maybe a year or two. And I think that the key here would be to keep a very strong eye on what is the current regulations that you need to follow, and go quickly both to your patients and to your healthcare professionals to understand what are the things that they need to in order to push it forward and accept it in their solutions. I think that that's the way that you balance. You need to always go to who is your customer, who is your user base, and validate there what is the minimum thing that I need to get you, and then you can generate the sufficient evidence for that.
Yeah, thank you. And I like the idea of the minimum viable process there.
Thank you.
Okay, next we have Henrik.
Thank you, Guido, for that good presentation. So my question is, so basically, I know you in this project that you've been doing, you had a quite bit of a rigorous approach on how to do product development. And then in the beginning, you said that, okay, with regulation is also important. What we've seen now in companies is that, of course, they don't usually have that much time to do the product development. They usually want to go to the market path. And that's why they've been sort of going the sort of well-being app pathway. What in your case, why didn't you go that pathway, sort of go to direct to consumer, put it on the app store, maybe generate some revenue? But this approach.
No, absolutely, and I think that that's a very vital question. So in our case, it was actually a topic of a lot of discussion, whether we should go to the well-being path or the medical device path. I think that the challenge here, or the way that I would approach that, has a lot more to do with what is feasible for your team. The challenge of going through a well-being angle is that, well, how do you differentiate yourself? There's hundreds of thousands of apps or solutions for well-being, for symptom management, for all of those things. It's a challenge. Basically, if you're trying to come up with a well-being solution, your well-being solution is competing with Apple Health, for example, or it's competing with Fitbit, or it's competing with whatever. So that's a big challenge that you have if you take the well-being approach. Whereas the approach that you have, if you're trying to go towards the medical device or digital therapeutics angle, is like, well, it's going to take a lot of effort and a lot of money and a lot of investments just to get through that angle. So what I would do here is I would try to approach this as a sort of a in-between. So for example, one thing that I would recommend is have an eye out for the medical device grade and think about what would be your middle stage reimbursement channel. Because, for example, if you are able to come up with a well-being solution that actually gets tracking and you have enough people who are actually using that, that is something that you can later use to provide enough documentation, provide enough evidence, and also get some traction with investors that would help you bridge to the next step of actually doing a medical device. The main thing here is that it's a problem of differentiation. It's like you are creating about, I think that it's 60 or 70% of all solutions that are right now available are well-being. Why do I take yours? And if I have a chronic condition, if I'm a person with a specific disease, one of the main things that make people choose, and this is not only present in our own studies, but also in a lot of literature, you want something that is specific to you. A thing that is very common is that if you're using like a Fitbit and you have this idea that you need to do 10,000 steps, it's super common for people with a condition to think, yeah, that's very good. That's for healthy people. I have this. How many steps do I need to do? So that's the other way in which you can maybe lose out by doing a well-being solution, is that maybe the specific target that you have will not think that the solution is fit for them, because you are not putting that in any way in your branding or marketing or in your value proposition, that this is specific for a person with X. It's a bit of a challenge. I think that what you need to do is somehow come up with, okay, what is your short to medium term plan? And then look into, because eventually there's going to be regulations that are going to push everyone who's in the well-being space, move into the medical space. So you need to be prepared for that.
Excellent point of view. Thank you, Guido. Any other questions? You can also use the chat if you don't feel comfortable opening the microphone. Meanwhile, I did have a question about using the HTA, Health Technology Assessment, as a guide for product development. How did it work out for you, or how is it working out for you, and what's your experiences about that? And kind of.
Well, I think that's a really interesting case. We were thinking about so again, when we started working on that with that approach as early health technology, I think that it was, of course, not the same version of the DGHTA framework that we have at the moment, because this was something that we did, I think, 3 or 4 years ago.
Yeah.
But I think that it was very useful because it presents you questions that you don't necessarily think as part of your normal product development. I mean, usually you think, okay, I will deal with the regulations by the time that I'm ready to go to the market. But if you are already thinking about the regulations when you're doing your software requirement definition, that changes the whole perspective. Because, for example, if you know that, I don't know, for privacy purposes, there is this requirement that your databases should be in this way and that way, or there is this requirement that you will be interoperable with different systems, that can change your whole product pipeline. And the earlier you know that, the more money, in our case, we actually saved, because we were actually approaching like, oh, this is something that we are gonna face a year or 2 years down the line. But at this point, since we don't have it developed, we just make a new thing, and now the database is this way, for example.
So your experiences and kind of guideline for other developers to actually have a look at EDG.
I think that early health technology evaluation, it's key. At least if you're thinking that you're going to be in the healthcare space, you're going to be bound by that once you're a product. It of course increases the amount of training that your own team needs to have, because, for example, it's not very common that the software developer or our engineer or whatever would actually know how to create a HL7 interoperable system. But it's easier if you're like, okay, well, I know that I need to have this API, or I need to have this thing already. It's going to be in the pipeline, and it's going to be a lot easier than if all of a sudden you build it thinking, oh, this is just like a normal survey, and all of a sudden you need to change the whole system.
Yeah. So being aware and kind of leaning forwards early on might save you some time and money actually later on.
Absolutely.
So you don't kind of crash in that way, so that you have developed something and then you find out that it's not valid. Now we have a question in the chat. Thanks for the tech talk. The app has been developed in an academic setting. Now, are you planning to go for a company setting, or is already available for any patients, healthcare provider that need it? So people are interested.
Absolutely. So we are now exploring how can you spin this off into a company. The main challenge is, as I was saying, the monetization part. That's one of the key things that not only our solution, all digital health solutions are struggling at the moment. And there's a lot of things that have a lot to do with where are you based. or where are you targeting? So for example, one of the challenges if you want to spin out here in Finland is that you need to figure out how does your solution aligns with the reimbursement pathways in Kela. Because if this is not something that is like, if fatigue management through an app, just to be blunt, is not part of the rehabilitation pathways that Kela can reimburse, that's going to be a huge issue. But for example, one of the things that we are exploring is like, well, maybe, and this is when the whole business becomes like counterintuitive in some cases, is like, well, maybe it's a solution that becomes global first and then localized. Because, well, one of the things that when we were talking with investors, and this is something that we continually talk to different investors and ways of developing the business, is there are people who tells us that, for example, maybe it makes a lot more sense that you throw the application first in the US market before coming back to the European market. Because one of the things that happens in Europe or in Finland is that if in the United States, they have this saying that someone can tell you no 1,000 times and you can still be a success. But if, for example, you're here in the Finland and you want to develop your solution, if Kela says no, that's it. That's the end of the conversation. So that's something that we're definitely exploring at the moment. But the idea right now is how do we make sure that the solution, that the spin-off that we do has a lifespan that is reasonable, because and this is something that I think, Florence, it's very important if you want to have as a key message here. It's when you're working in healthcare, you're making a commitment to that population base that is different than the commitment that you make if you're doing any other kind of solution. If I make a running app, you're always going to be able to find another app that is going to be the same kind of features. But if me as a patient, I have decided that I want to commit to this app and I have invested, and you have my health records, you have all of this information about my health. If you go broke, what happens to me? What happens with all of the things that I have relied on you for that? So that's the challenge here we're talking about when we're trying to spin out into an actual company. How do we make it that this is sustainable? And that's a completely different conversation and a different sort of challenges than just launching a company and see what sticks.
That's a good point, and kind of refreshing to me to have the point of view of the patient and the user, and actually the commitment of a developer to the user, and I really like that.
Thank you.
Yeah. Since we are in HealthHub Finland EDIH webinar, many of you might know, and for those of you who don't know about the HealthHub Finland, it provides these kind of support services for digital health development and digitalization development. So in your experience, Guido, has there been any useful support services for you? Have you used any, or is there something you would like to have that doesn't exist at the moment that we as public organizations could try to develop further?
I think that one of the things that are very useful of the HealthHub Finland is specifically the pop-up clinics. This thing that if you're interested in developing a solution, if you're interested in doing something in Finland, you can approach these different spots that are available in different events, in different universities, in different parts of Finland, and get the opportunity to talk one-on-one with someone who understands the landscape. That's something that is really useful, and that when we started this process, it was not available. And I think that is key about the services that this EDIH provides, because all of this talk, all of these things are very abstract until I get to do the thing on my own. And in that sense, having the opportunity to go and talk to a specialist that is going to tell me like, okay, well, you know what, for this thing, maybe you can get funding from Business Finland so that you can do development. Or maybe this is something that this other pathway can support you in this way. These are things that by having this opportunity to talk is really useful. And I really encourage anyone who has an interest in developing a solution or launching it in Finland to take advantage of this opportunity and reach out to the specialists that are available, because it's basically not very common that you have someone that you can bounce off ideas with and have that kind of personalized information that you may use.
Yes, that's a good point. And maybe HealthHub Finland can also help with, if you're coming from more technology or development side towards healthcare, or the other way around, it can help you fill the gaps and get the right contacts to take your development further.
Yeah, and one thing that, for example, I think that would be very useful from the perspective of if I'm an innovator and I want to approach HealthHub Finland, would be having very clear guidelines for different parts of the process, because that's the thing that is the most challenging when you're trying to develop something in Finland, that not all of the resources are available or easily available for someone who is not native to the system. So in that case, like the more effort that it becomes so that it's easy to understand from an outsider perspective, I think that would be very useful, like maybe like slides or maybe decision trees. Those are things that I think are always useful, at least to guide the thoughts, because from my own experience, even as someone who advises different startups in different processes, is that in general, you don't know what you don't know. And you wouldn't be thinking about how do I tie my solution to Kela unless someone tells you you need to tie your solution to Kela. So I think that a bit of work in that way, in spreading awareness of the specific context of Finland, would be very useful.
Thank you. I think point was taken, and hopefully we get to work towards that kind of support and making the picture more clear. Do we have any more questions, or are we happy with today's session and ready to keep on going with our working days? So now is the last opportunity to give your question or comment at the moment. Henrik added the link to the webinar series. Thank you, Henrik. If we don't have any more questions right now for Guido, I'm sure you can contact him and the recording will be available also, so you can have a review and refresh of the great presentation. So thank you, Guido, very much. This was enlightening.
Thank you, everyone, and happy to help, and please reach out.
I'm sure people will. So the next session of this webinar series will take place already in a week, and then the theme will be, let me check, collaboration promises to revolutionize healthcare education. And there in Henrik's link, you can find the registration and more information about the next webinar. For now, I would like to thank you all for participating and have a great afternoon, and see you next week on the next webinar. Thank you.